Hello and welcome everyone to this much anticipated event on the impact of COVID-19 on Africa. Not the impact right now alone, but also looking towards the impact of COVID-19 in the medium to long term. Today, this afternoon, you will hear from speakers from the Institute for Security Studies, from GIBS Business School, as well as from the Frederick Pardee Institute for Futures Research. Sorry about that. I am Otilia Anna Maunganidze, and I head special projects at the Institute for Security Studies. And I'm extremely honored to chair the seminar, as well as to moderate the discussions later on. The seminar is being live streamed also on Facebook, and a recording of the seminar will be made available to all participants. The research that you will hear about this afternoon is as a result of great collaboration between the ISS, GIBS, as well as the Frederick Pardee Center for International Futures at the University of Denver. The first speaker this afternoon will be Dr. Yaki Cilia, who heads the African Futures and Innovation team at the ISS, who will give us a broad overview of what it is that COVID-19 will really impact on the African continent. We're looking specifically at issues around health, water, sanitation, but also looking at the issues around urban renewal and the impact on the economy. Dr. Yaki Cilia will then be followed by inputs from members of the research team. This was in many ways a collaborative effort. It wasn't a research product done by one individual, but a team of experts that worked together over the past 6 weeks to be able to bring you this research. Importantly, also, the researchers consulted with a research study group weekly at looking at not only what is currently going on, but what would be the policy implications. We're extremely honored that the Hans Seidel Foundation, as well as Humanity United, supported this initiative. Without wasting too much time, I will now hand over to Dr. Yaki Cilia, who will introduce the research.
Thank you very much, Otilia. I'm going to share my screen and show a few slides, and do so quite briefly to move on to give you an idea of the work that we have done. Hopefully you can all see the slide that I'm showing, which is headed Exploring the Impact of COVID-19 in Africa, a Scenario Analysis to 2030. The approach that we adopted is we have developed 3 alternative scenarios. They are called V, U, and L, after the shapes of the scenarios themselves, on the impact of COVID-19 in Africa, and we use a forecast horizon to 2030 so that we can look at the impact on the Sustainable Development Goals. And we compare the impact with a pre-COVID-19 scenario. We use the International Futures Forecasting Platform, hosted and developed by the Frederick S. Pardee Center at the University of Denver. There were 3 consultative sessions with about 200 content national and regional experts in the process of conducting this research. We had 3 small expert working sessions on growth, on health, and to help develop the policy recommendations. And for the forecast, as I will explain, we used the IMF growth forecasts that came out in October of last year. That is the basis for the pre-COVID growth pathway. And then we used the updated IMF growth forecast that came out in April of 2020. We use that because the IMF then brought in the impact of COVID-19 globally. For mortality and infection rates, we used the Imperial College Global Impact Report that came out in March 2020. We also did significant additional data collection and desktop research. The International Futures Forecasting Platform is hosted by the Frederick S. Pardee Center for International Futures, and it is a platform that allows you to look at where you have come from, how to understand the social, environmental, and systems, how they interact over time, and to help shape the way we think about and address the major issues facing humanity. It is in many senses a massive algorithm and database that does forecasts of 500 variables from 1960 to the end of the century, and it is for 186 countries. Jonathan Moyer, the director of the Pardee Center, will say a few words about methodology a little bit later. We framed the scenarios primarily along two dimensions: economic impact, which is on the y-axis, and mortality, which is on the x-axis. We developed three scenarios. The first is what we refer to as a V-shaped economic impact with relatively low mortality, and we also factored in the additional social grants that African governments have embarked upon to alleviate the impact of COVID-19 in Africa in 2020. A second scenario was a U-shaped economic impact with intermediate mortality. We also brought in the same amount of social grants in 2020, but then because the U-shape recovery is only in 2021, we brought in some additional social grants in 2021. And then the L-shaped, or the worst case economic impact. This is where economic recovery is much slower than with U or with V, with a high mortality. Also, we factored in social grants in this scenario. Now, this may be a little bit confusing, but many of our listeners and people that have joined would know the standard way in which one does scenario analysis. We therefore did not look at a V-shaped economic impact with high mortality or an L-shaped economic impact with low mortality. So if this all seems a little bit confusing, let me show you the growth rate assumptions that underpin the forecast from the IMF on our growth rates. So this is the pre-COVID growth rate for Africa that the IMF released in October of last year, October 2019. It shows a modest forecast on average growth rates of Africa till 2030. And then in April of this year, the IMF, this is after COVID had started, brought out its growth forecast that basically looks like that. That is the basis for our V-shaped economic forecast. In the U-shaped economic forecast, what happens is that globally and Africa only recover from COVID in 2021. And in the L-shaped scenario, Africa only recovers from COVID-19 in 2022. So those are the V, U, and the L-shaped scenarios that we used as a basis. Just for the purposes of comparison, this is what the IMF forecast of what the growth rates in the rest of the world will be like over this period. Because Africa comes from a low base, it has many more low-income countries, poor countries, Africa generally grows much more rapidly in terms of growth rates. So that is the base for the economic interventions that we used for the three scenarios. The average growth rates that we have, excuse my dogs, are for the pre-COVID growth rate is about 3.8% compared to for V 3.2, for U 2.9, and for L 2.6% growth rates out until 2030. The average growth rate for the rest of the world is about 1.6%. These growth rates for Africa are significantly below what is required to alleviate extreme poverty. I think that is self-evident. So if we then look at mortality, what are the interventions we used in mortality? The mortality interventions come from an Imperial College study that was released in March of this year, and we use their best and worst case mitigation scenarios. In the forecast that we use, in the we classify COVID-19 as a respiratory infection in terms of the global burden of disease classification at the University of Washington in the US, who does which serves as an international repository and for the burden of disease and for infections and mortality and so on. We use the concept of additional mortality. So we make a distinction between mortality that comes directly from COVID-19 and the additional mortality that comes from the impact of reduced health spending. Now, that is quite important because what the impact of COVID is that people die, but because the economy, Africa's economy contracts significantly, health spending in Africa reduces, and that impact has a significant effect, as I will show you. So this is the additional mortality, that is both direct and indirect mortality from COVID in the V scenario. So on the left-hand side are thousands of people, so it goes from 0 to 1.6 million people. And we can see the black is respiratory infections. We model COVID as a respiratory infection within the International Futures Forecasting System. And the light gray bars are the additional mortality that largely come from the reductions in health spending that follow the impact of COVID. This is the additional mortality in the U-shaped scenario. And this is the additional mortality in the worst case L-shaped scenario. So you can clearly see, if you look at the interventions in 2020, 2021, and 2022, how we have intervened to use the Imperial College forecasts of mortality to model different assumptions of the impact. You can also clearly see the impact, the indirect mortality that follows from the reductions largely in health spending. So over time, from 2020 till 2030, in the V-shaped scenario, probably about 645,000 people will succumb because of COVID and additional respiratory diseases, about 1.2 million from the impact largely of reductions in health spending, giving you a total of about 1.8 million Africans that will probably die because of the direct and indirect impact of COVID. In the U-shaped scenario, it's about 3.2 million or 3.3 million people. In the L-shaped scenario, about 5.3 million people. These are not big numbers if we consider that Africa at the moment has a total population of about 1.3 billion. And many of you will know that a reason for relatively low mortality in Africa is because of our youthful population. But that advantage of a youthful population, because COVID affects largely elderly people, could be offset by two considerations. The one is the fact that we have lots of comorbidity in Africa. The second factor is that health capacity in Africa is significantly lower than, for example, in Europe and North America. And there's quite a lot in the report, which is now available on the web, that looks at these relationships. The third intervention that I spoke about when I framed the scenario is that we also modeled the additional impact of social grants. African governments have reacted quite rapidly responding to COVID, and some of them have rolled out additional social grants, food parcels to alleviate the impact. So we modeled that to see what the impact of that would be. Unfortunately, we only had data for limited countries, so we used an average for the rest. And we scaled that delivery of social grants in line with the shape of the scenario, V, U, and L. So in the L scenario, more social grants over a longer period of time would be provided. So what is the impact of these scenarios on extreme poverty using $1.90? On the left-hand side are millions of extremely poor Africans under the pre-COVID scenario, that is the dotted line. And then the blue line presents the V-shaped scenario, the orange line is the U-shaped scenario, and the red line, the worst case L-shaped scenario. And on the right-hand side, the same graph, but now it shows extreme poverty as a percent of total population. So at the moment, about 36% of Africans live in extreme poverty. We were expecting that number to come down quite rapidly, but now we can see that in actual fact that is not going to, only in the instance of the V-shaped scenario, will we see in percentage terms a reduction in the number of extremely poor Africans. So if I were to put this in a different context, in 2019, about 470 million Africans live in extreme poverty out of a total population of about 1.3 billion, or about 36% of Africa's total population. And we were expecting by 2030 that about 570 million Africans would live in extreme poverty, or about 33%. That is now under the V, U, and L scenarios going to change to about 603 million Africans, or 35% of Africa's population, or 615 million Africans, or 36% of Africa's population, or 631 million Africans living in extreme poverty, or 37% of Africa's total population. We've known for quite a while that Africa will not achieve Goal 1 of the Sustainable Development Goals, which is eliminating extreme poverty. And what COVID has done, it has set Africa back, according to the UNDP, by about 6 years in terms of its development trajectory. What do our forecasts do on GDP per capita? So it's a bit of a messy graphic, but it shows every African country divided into low-income African countries, lower middle African countries, and upper middle income countries. And it shows the reduction in GDP per capita from last year, 2019, till 2020 for every country. And I know some of the graphics are a little bit over one another. So there is a table on the right-hand side that shows that, for example, in Nigeria, GDP per capita on average is probably expected to decline by about $353 US. This is in 2019 US dollars, from 2019 till 2020. I'm in South Africa, and in the case of South Africa, we're an upper middle income country, so we see a significantly larger reduction, $946 US dollars. The only high income country in Africa is Seychelles, and it's therefore perhaps no wonder that Seychelles, because it comes off a much higher base, is going to see the largest reduction in GDP per capita from last year to this year of over $4,500 US dollars. If we look at what that means at a continental level, so again, on the left-hand side, 2019 US dollars, and then a forecast from 2018 till 2030, and it shows where Africa would have been in GDP per capita. A slow but positive increase on the dotted line, the reference or the pre-COVID scenario. Now what's going to happen is that in the V scenario, the best case, Africa only gets back to its 2019 average levels of GDP per capita by about 2024. And in the worst case scenario, the L-shaped scenario, Africa only gets back to its 2019 levels of GDP per capita by about 2029. COVID-19 will have a severe impact on Africa. So, to summarize, we have three scenarios on the left-hand side, V, U, and L. And what is the difference between the impact of every scenario with the reference scenario? Well, in the V scenario, 12 million more Africans in this year will be classified as living in extreme poverty. By 2025, it'll be 21 million more than the reference scenario, and by 2030, 33 million more Africans than above the reference scenario. For U, of course, because the growth trajectory is the same for V, U, and L, the figure for 2020 is the same for all three scenarios, but over time, the difference increases such that by 2030, in the L scenario, about 61 million more Africans will be living in extreme poverty than otherwise would have been the case. Incomes per capita, on average, all African countries will experience a decline in average incomes of $252 per person in 2020, and then the figures for 2025 and 2030 are provided. In the worst case, by 2030, average incomes in Africa will have declined by $415 compared to the reference scenario where Africa would have been by 2030 had we not had COVID-19. These are the mortality. This is both direct and indirect mortality. So you can see the difference in the interventions that we made, drawing upon the Imperial College analysis. In 2020, 450,000 deaths from COVID, directly from COVID in the V scenario, but 1.6 million in the L scenario. And the last column presents the difference in economic activity in Africa the impact of COVID on the size of the African economy. This year, Africa will suffer a loss in our forecast of almost 150 or about 158 billion US dollars. And that could be almost close to $500 billion in 2030 compared to where Africa would have been on the pre-COVID trajectory by 2030. So this table provides a summary of the impact of COVID along poverty, income per capita, deaths and indirect deaths from COVID, and the difference in economic activity in 2019 US dollars. All this data, I know it's a lot of data, is in the report which is available online on the ISS website. So what? I think that the first thing is that Africa is seriously affected by a crisis that is not of its own making. And it is clear that the economic impact of COVID is serious. African government's decision on early lockdown and restrictions were, in our view, entirely appropriate and correct. Africa is behind the curve in COVID. We had time to prepare. That has saved, in terms of health, significant amount of lives probably, but we cannot escape the economic impact, which is going to have a dramatic impact on Africa. Beyond emergency measures to fight and mitigate the short-term impact, we need to build future resilience and improve long-term growth prospects. And the study concludes with 4 key policy recommendations. And colleagues that are on the call with us this afternoon will expand upon these recommendations. The first is an emerging debt crisis that will require a moratorium and probably some debt forgiveness. The impact of COVID is to make debt a real crisis. Africa needs to improve and increase its health spending. About 41 African countries have experienced a pandemic in the last decade, yet Africa spends significantly below the global average. We have poor access to basic infrastructure, water, sanitation, even electricity. 40% access and improved sanitation in Africa versus 80% in the rest of the world. Clean water, it's 78% versus 97%. And all of this underpins the need for greater efforts towards the economic transformation of African economies. Provision of food security, leapfrogging, and regional trade is very important. Here, I was able to draw upon some of the results of a recent book that I published that looks at igniting a growth revolution in Africa. And with that last self-serving advertisement, I'll hand over to Ottilia.
Thank you, Jackie.
I'm sorry, Ottilia, one final word. My apologies for this. We will bring out a revised forecast in July once the IMF have released updated growth forecast. Apologies for that.
Not a problem. Thank you very much, Jackie. Before I turn to, the team of researchers that worked with you on this report in particular, I'd just like to briefly turn to Marius from GIBS. If you can maybe, almost give us a bit more of a quick capturing, if I may, of why it matters so much for us to have these 3 different forecasts. I'm sure as people are watching and tuning in, they're wondering which of these will be the one that we find ourselves in. If you can maybe, Marius, just briefly tell us why it's important to do this kind of forecasting and this kind of scenario planning. Thanks.
Well, thank you, Ottilia, and thank you, Jackie, for a great summary of the work done and for the team that have pulled all this together. I think a few top of mind thoughts from my side. Africa, we know ahead of COVID was facing a range of different issues: social vulnerability, economic growth inequality, issues around low productivity in Africa. And so what COVID has really done is brought to the surface these pre-existing fault lines on the continent. But what the crisis is forcing Africa to do is to make decisions about where it puts its limited resources. In the next few months, in the next 2-3 years, African governments are going to have to choose between mitigation and investments in health, for instance, to combat the disease, versus more fundamental investments in growing the economy, in creating inclusive infrastructure, in expanding the formal economy to create jobs. And so the ability for African governments to make those decisions and to make those difficult trade-offs is going to require that we think not only about the past trajectories of African countries, but the current and future trajectories of African countries. And of course, this is what scenario planning enables us to do. I think what Yaki's inputs have shown us is that many of the challenges that Africa will face are beyond what African countries will be able to do on their own. And so this really, and this is my last point, will call for a very high level of partnership between Africa and the rest of the world, between African countries and bilateral relations, as well as then, of course, within Africa, as African countries club together to address some of these large challenges. Let me leave it there, Talia.
Right. Thank you very much, Marius. I'm going to turn now to some of the researchers that helped in conducting this research, but also in helping formulate and shape some of the key recommendations. Yaki, you spoke quite a bit and at length around the issues of mortality on the African continent, but perhaps also related to that, as we face a health pandemic at the moment, is the impact on health specifically. So turning to you, Stella Kwasi is a researcher in the African Futures and Innovation team at the ISS. If you could maybe describe a little bit more why the additional mortality and the policy measures related to health, what those are and why those matter, and if you can touch a bit on the recommendations going forward, Stella.
Thank you, Yaki, Otilia, and Marius. I will briefly discuss the additional impact on the health system in Africa. Now, besides the increasing demand for healthcare of people with COVID-19, Africa is tasked with maintaining the delivery of routine health services. This includes malaria, HIV, and TB, for example, which risk being sidelined and could in fact increase if African countries do not maintain critical prevention activities and services. One of the prevention activities is the availability and accessibility of medicines and vaccines, for example. As of 10th June of this year, the UNICEF reports that because of collapse of the airline industry, shipments of vaccines have been severely impacted as a result. And this has had far-reaching impacts when you compound that with lockdowns where people cannot then access essential services that are still ongoing anyway. And so unsurprisingly, costs have increased significantly beyond the budgeted estimates that these health activities would normally incur. So because of the supply disruptions and challenges, I think it's telling for also when an effective COVID vaccine will come around, Africa would struggle to ensure affordable and universal access if an equitable global framework is not established to support a successful rollout. And we can already see this with testing equipment, for example, where African countries are struggling owing to global demand and competition in that regard. So given all the factors at play, it's very critical for Africa and its development partners to consider and probably re-engineer investments in the healthcare system. This would involve better healthcare governance, as well as supportive financing policies around health in Africa. And some of the measures we came up with, which could be further synthesized to fit a more specific country context, we came up with a couple of recommendations that would require adequate investment in preventive measures, and this would include clear leadership and messaging, as well as awareness campaigns around hand washing, social distancing, wearing masks, as well as sensible decision-making by the public. Another thing is adequate allocation of funds to public hospitals where the majority of the population can access treatment. Greater investments in primary healthcare as well. This would enable hospitals, especially in rural areas, to carry basic testing and diagnostics around COVID and other health challenges. There would also be promoting better cooperation and engagement between national and sub-national levels, especially in countries that have experienced epidemics like Ebola. They already have existing infrastructure and capacity to carry out such activities. A more flexible operating framework as well between public and private hospitals to ensure adequate health personnel through flexible and simplified hiring processes, as well as sharing essential equipment. Another thing from a continental perspective would be better and transparent procurement systems. Africa is facing a testing shortage, which then also impacts how well we deal with COVID. Therefore, a united voice and action plan on a continental level would then help achieve progress in this regard. Another thing would be greater integration of scientists into public discourse using technology and innovations, a lot of which have come from Africa, as well as greater partnerships in the medical research field to cut costs. We would also need to create a disease and public health surveillance system to collect data, monitor, and mitigate havoc that could be caused by outbreaks in the future. And in conclusion, greater cooperation in all sectors would be quite useful because COVID goes beyond health. It's affecting all aspects of life. I will stop there. Thank you very much.
Thank you very much, Stella. You've already said it, which is that the issues and the response to COVID-19 now, but going into the future, go beyond health. So I'm going to turn very quickly to TK Pwe, who will cover the issues around water, sanitation, as well as urban renewal, and the things that are needed to accelerate investment in infrastructure, particularly in urban centers. But, you know, as you were speaking, Stella, the first thing that came to my mind is that at the moment, one of the main things that's being called on for the public to do is to wash your hands, sanitize all surfaces, and to do this regularly. And yet this is advice that's coming when on the continent at the moment, we're still so far away from reaching firstly, the Millennium Development Goals, but the Sustainable Development Goals to be able to ensure that every African has access to water and sanitation to begin with. So TK, I'm basically asking you, how do we accelerate this such that should there be a pandemic in the future, that we don't find ourselves giving the same advice, but that millions of Africans are simply unable to follow? TK, over to you, and TK is with GIBS.
Thank you, Atilia. Well, look, I'll start maybe by piggybacking on what Dr. Segia stated, but that this is a pandemic not of Africa's making, but it has actually highlighted, as you're saying, the key constraints which have been affecting Africa, especially when you think about infrastructure and the urban area. And I think I'll probably just dwell on this. What I mean by that is, if you look at many African cities, and I know we use the concept city, but what we're trying to basically say, it's almost relics of a colonial past, which, if you look at the basic infrastructure in terms of your bricks and mortar, it's actually, it's a lot of hodgepodge. You tend to find that a lot of informal areas have actually developed from your more metropolitan areas. If you think about it, I mean, if you look at Kenya, if you look at South Africa, Nairobi and Johannesburg, you find that there's a lot of informal areas, and such grounds have actually been quite, one can say it's almost like it's a perfect storm for a dynamic such as COVID, which really raises the question to say we need to actually look at how and where finance is going in terms of infrastructure. And I know when you say infrastructure, people readily go to the bricks and mortar, but one of the things which we're finding is that, as you were saying, when people speak about social distancing, what COVID has highlighted is when you say infrastructure, what about public transport? The fact that we live in a very high density levels, when you look at your Nairobis, when you look at your Cairos, and when you say public transport to people, you really are basically speaking about packing people into a form of transport where there's normally 3 to 4 to 5 people in it. And this really allows COVID to spread quite quickly. So if you're asking for, we're not going to say this is not going to be solved in the next few years, but something which we really need to really look at is to roll out to say, listen, when we speak about public infrastructure, let's start with public transport. Can we really create a system that allows one that really goes with it along with the economy? And here I'll just cite an example. When you look at South Africa, where the average person has to wake up around 4 to 5 o'clock and catch a taxi. And as we're finding out lately with taxis are a private enterprise, which are basically feeding off a public government weaknesses. So that's maybe the first place to start. And then we actually have to look at what we mean by urban areas and where businesses are centered. we're finding a lot of times when you look at informal areas, it's a lot of shanty towns, basically a lot of informal areas in the material which are used. And the problem tends to be that in that one informal area and that one, and we call it, for lack of a better word, that one structure, you'll probably find that there's 3 to 5 people in it. And it actually makes water provision very hard, because as the report touches on, it's not as though it's 1 or 2 people sharing water in that one informal housing. You tend to find there's 3 to 5. So that's where we really need to, maybe the first thing is to actually get our numbers correctly stated, because I think that's what this research project is also highlighted, to say when we speak about informal areas and housing, what do the numbers look like? Because public policy devoid of actual evidence-based thinking means we're basically just throwing money to, we know there's informal areas, we're throwing money, but we're not really making it that dent and imprint. That really is going to speak to the fact that we need to really rethink what we mean by urban areas in a post-21st century African setting. And this might mean that we might have to redesign our cities in such a way that it speaks to the informality of it. And I think that's going to probably be one of the biggest legacies of speaking to COVID, the fact that we're going to have to really look at our public budgets to actually reflect the informality of how we do things. I think there's a lot more a person would like to say, but I'm just wary of time and allowing other colleagues to speak.
Thank you very much, TK. I think, you know, by raising this issue around informality specifically, but there's a point you made, which was that infrastructure or whatever action and response has to go with the economy, as it were, which I think is the points now that Kelly, your colleague also at GIBS, can be able to respond to now. You know, there's been a lot of talk around how lockdowns and the impact of COVID-19, again, as Stella said, beyond health, will have a heavier impact on the economies. And we've seen from Yaki's presentation specifically what that really looks like for the African continent, perhaps except for Seychelles, but what that really looks like for the African continent. So Kelly, turning over to you, you know, we would like to get a bit more of a handle on what the real economic impact for COVID-19 will be, but perhaps also looking at what some African countries have already been calling for, which is debt relief. What happens now and what happens in the coming years to limit African countries' debt and hopefully unlock growth. Kelly Alexander from GIBS.
Great, thank you. And indeed, so a lot of what I'll touch on now, my colleagues have already made reference to, so these are complicated and complex issues, but I have 5 minutes, so I thought I will just briefly discuss 5 points. So the first of these is the issue of debt. Then I'll look briefly at the economic contraction that we've seen across African countries. Then I'll have a look briefly at economic transformation and the potential that we can leverage partnerships to achieve this. I'll touch briefly on the geopolitical pivots and the impact of manufacturing, and then we'll look briefly at digitization. So if we look at debt, we see that there are very high levels of debt across the continent. In certain cases, this is the result of large lending in the name of infrastructure projects, for example, in Kenya, Ethiopia, and Angola. The issue of debt is exacerbated by the poor credit ratings that we see across the continent. And this really means that the cost of servicing debt is that much higher for African countries relative to the EU or the USA, for example. In line with the COVID response, we have seen that there have been calls for debt relief and debt cancellation in certain cases in order to prevent a debt crisis really becoming a major challenge for the continent. And what's been really positive is that we have seen some willingness in response to these calls to support Africa in this regard. The second point that I'd like to touch on is the economic contraction. So we've seen the lockdown measures have obviously had a negative impact in terms of trade and reduced economic activity. And this has meant that there's significantly less revenue for governments. This obviously then feeds into the issue of debt that we've just touched on. We can also see that there's an expected decline in sectors such as tourism, which is a major economic driver across the continent. We expect to see declines in remittances, as well as a shock for energy exporters across the continent. In addition to this, particularly affecting low-income countries, we see that there will be a decline or an expected decline in the level of net aid that flows into the continent. And this will really hamper, especially poorer countries, in their efforts to to mitigate the economic contraction in response to COVID. So debt and this economic contraction, those first 2 points are really the negative side of COVID. But we're optimistic. We see that there is some potential for some kind of economic transformation. And as we're in the moment now where we can see there's a need to focus on restoring economies and getting economic engines back on track. What was really nice to see in the COVID response was that there was very effective use made by governments of partnerships. So we saw business, civil society, and governments coming together, and these cross-sector collaborations were really effective in certain cases and provided a new way of managing the economy. So we hope that these cross-sector collaborations can be repurposed with the intention of driving rapid growth, much more inclusive growth, building towards sustainable growth and development, and particularly with the focus on renewable energy. And we believe that this will be able to mitigate some of the negative impact of the boom-bust cycle that we see, which is particularly detrimental for countries dependent on commodities exports. My fourth point is the geopolitical pivot and the impact that this has on manufacturing. So we've seen this change in geopolitical power and influence, and there's a global tilt towards the East. In line with this, we also see that there have been calls made for diversification of global supply chains and a move of manufacturing much closer to the consumer. So as these global patterns of production shift, we see an opportunity for Africa to really raise its hand and signal that the continent is open for business, to take the opportunity to invest in industrialization and to make better use of its human capital. My final point is around digitization. And here we're really looking at the role of internet, of technology, mobile phones, and local innovation. We've seen really strong positive partnerships for a so-called smart recovery, which can unlock potential and accelerate initiatives around education, for example, which can really drive improvements across the continent. In addition to this, we believe that digitization and technology is a real strong opportunity for driving inclusive growth across the continent and accelerating programs such as the African Union's digital transformation strategy. My final point in relation to this is that digitization and technology provide the opportunity to start to formalize increasing sectors in the informal economy. And what this means, if we link back to the first 2 points we mentioned around debt and the economic contraction, is the opportunity for governments to generate more revenue locally through formalizing the economies and hopefully mitigate some of the reliance or the dependence on debt. So just to summarize, we looked at debt, the economic contraction, the opportunities for economic transformation through new partnerships, the global geopolitical shifts and what this means for manufacturing, and the increased role of digitization. Thank you.
Thank you very much. Colleagues, I see your questions coming in already. For those of you who haven't yet used the Q&A function, right at the bottom of your screen, you can select to pose a question through that function. You can also just send a comment in the chat option. I see TK already fielding some questions and responding to comments, so thank you very much for that. Before we open up and have the discussion and I go through some of the questions that have already been posed, I'd like to pivot to the Frederick Pardee Center now and really just have a word from you specifically around the method and the rigor of this kind of research, but also perhaps some of the limitations. I'll hand over to you, GIBS, as well as Jonathan.
Okay, thank you so much, Otilia. My name is Jonathan Moyer. I'm the director of the Pardee Center for International Futures and a faculty member at the Corbell School of International Studies at the University of Denver. We're very pleased to be a part of this partnership, and I'm very happy to see the ISS and GIBS and Pardee Center kind of come together in this collaboration. I thought the co-authors did a fantastic job of bringing together a wide range of really complicated information in a short period of time. So congratulations to everyone. I'm putting a brief note in the chat to everyone that gives you more information on the model if you're interested. So we're an academic research center, and our model is an open source tool that you can download or use online. We support a large number of research projects that are focused on thinking about the long-term future. And when we're thinking about the long-term future, it comes with a lot of caveats and considerations when thinking about what we can and can't know. And within this project, we deployed two different kinds of methodologies that came together, more of an expert elicitation and a quantitative modeling exercise. When you think about what you can and can't know about the long-term future, I think it's important to think about the tools that we have. And these methodologies are simply tools that we use to explore a deeply uncertain space. The outcome of this work shouldn't be thought of as a prediction. The outcome of this work should be thought of as a tool that can help us better understand how to think about the challenges and opportunities that African leaders and civil society faces and confront this global pandemic that's not of their making, and the ways in which systems work and unfold across time. So that's the purpose of this kind of research, is to help us understand and think more carefully. And this kind of a venue where we are, like, one of the benefits of COVID is that it's not so hard to have 250 people come together in a virtual space to have a discussion like this. So there's an opportunity for us to have a conversation like this in order to further our collective understanding about how this pandemic might be unfolding, what we know about it, and then what we still have to treat as a deep structural kind of uncertainty. So my time is very brief, so Otelia, I'll turn it back to you, and thank you very much.
Thank you very much, Jonathan, for that. There are already 8 questions in the Q&A box. You're also welcome to raise your hand by clicking on the participants feature if you would like to pose your question verbally. For those of you who would like to do that, please follow suit with the people that have written out their questions, keeping them brief and to the point. We'll go through 3 questions at a time. So the first question, which is from Tabitha Mwangi, is, and this is to everyone that's presented, but I'll give first dibs in this case to Yaki to respond. What are the cost-benefit analysis issues that African governments should take into consideration in deciding when to lift COVID-19 related regulations, such as lockdowns, as well as restrictions on movement? The next question comes from someone who chooses not to be named, which is, what are the opportunities that could be exploited by the continent to accelerate COVID-19 recovery? And then the third question from Alex Mwamba is that decisions by African governments on whether to open or close their economies have been informed largely by policies from other parts of the world. Where will leadership on this matter really come from? And what needs to be done to get right the balance on how long to remain closed or open for the economy? Alex, as well as Tabitha's question, are very much the same question in many regards. And then the third question is obviously around what opportunities can be exploited. I'll hand over to you, Yaki, and then anyone else from the panel who wishes to respond to the questions, please feel free to do so.
Thanks, Otelia. I think our report indicates that we generally believe that Africa acted early and appropriately in responding to COVID. Africa's ability to respond to COVID is, however, quite limited. I think the UNECA estimates that Africa is spending 0.5% of GDP. I think globally, something like $8 trillion has been spent in responding to COVID. That is several times the GDP of Africa. Africa's GDP is just over $2 trillion. So we are the victim of something that we play no role in. We are protected by our youthful population, but as I indicated, comorbidity and the low capacity of our ability to respond to COVID means that our demographic profile, our youthful population, provides a limited degree of protection given these other two factors. So I think our analysis is that African governments generally acted quite expeditiously in trying to deal with the impact and bought time. But now, in our analysis, the pandemic is coming to Africa, and we will see very rapid increases in infections. And to a lesser extent, because to thus far Africa has had relatively low mortality, we also expect relatively low mortality. And the forecast that we have presented, given Africa's population of 1.3 billion, is quite modest. So our challenge really is how do we, on the one side, what are the appropriate responses given our limited means to be able to deal with what the question referred to, the cost-benefit analysis. And I think it is not possible for Africans to continue with extreme lockdown and social isolation policies for a variety of reasons. Large informal economies, crowded settlements, and so on and so forth. So we have to find a uniquely African solution that is really mostly about community engagement, education, and really trying to make sure that the practices at the Mutata to every level is informed by what are good social practices. And we have to manage the disease as it is going to slowly but steadily overwhelm our health systems. So we have bought the time. We are now going to have to manage the challenge of COVID going forward. I'm going to leave the other responses perhaps to colleagues.
All right, Marius, I see that you've unmuted yourself. So if you can respond to any of the other questions, please.
Thank you, Atalia. Maybe one brief comment on the question of opening versus closing and those policy options, and then one comment on opportunities. I think we have to recognize that the pandemic, of course, started in Asia and then came to Europe and the US at around about the same time and has come late to Africa, as Yaki said. So when African countries made the decisions to opt for lockdowns, they weren't, in one sense, simply importing policy choices from around the world. We had an opportunity as Africans to see what happened in Asia, to see what happened in Europe. And so to a large extent, our response, I think, was informed fortuitously by what we saw happening in those countries. But I do think, as Yaki said, going forward, we would have to take a much more sophisticated approach to what I would call a blunt sort of collective lockdown. We have to take much more of a sophisticated, targeted approach. And we are seeing very interesting innovations in this regard. And this brings me to the second question, which is around opportunities. We're seeing, for instance, in South Africa, big data analytics being used for tracking and tracing. We're seeing innovations in the health sector as African countries innovate with very limited resources in response to things like ventilators. And so in some ways, the opportunities for Africa is contained within the crisis. In our report, we refer to the fact that some African countries, in dealing with the Ebola outbreak, in fact, developed some healthcare capacity, monitoring, nursing training, that in this context actually has stood them in good stead. And so what Africa needs to do is look within the crisis and to say, what are the competencies and public capacities we can develop, whether it's infrastructure, whether it's human capital, whether it's technology, to cope with the crisis, but to position ourselves better for the future. And of course, as we cope with the lockdown environment using digital technologies, as Kelly said earlier, that creates a vast opportunity for Africa in the education space. Let me hand over to you again, Otelia.
Thank you very much for that. I'm going to go into the next set of questions, and I've grouped these ones based on their linkages on issues around demographics and gender. The first question is from Nadia Aijo from the Open Society Initiative for West Africa. And her question is on gender disaggregated data and what are some of the gender or intersectional issues that people need to be mindful of. The other question then is from Levi Singh. What impact do you all see COVID-19 having on Africa's chances of harnessing its demographic dividend potential? Are we damned to a lockdown generation if we don't center the next generation in recovery plans? And then the final question for this round from Vuyani Majola is, what is the future of public education system, especially those living in abject poverty? For this round of questions, I will ask my panelists if you can please just indicate if you wish to respond to those questions. 3 questions. 1 on demographic dividend from Levi Singh, Vuyani Majola asking about the public education system, specific on issues of abject poverty, and Nadia Aijo asking the question on gender and the intersectional aspect that need to be looked at. TK?
Or I'll just probably grab the one on education because it's my varsity is also struggling with this at the moment. I look at it in 2 ways, and I think probably Dr. Salias probably touched on it to say while it's always good to understand what COVID is and what it has done, we should also not just erase the fact that there's been bad decisions which have been made. And those bad decisions can't simply just be erased. And I think maybe when it comes to education, and Marius always makes this point to say, it allows African countries, because when I wanted to expand on the definition of infrastructure as well, to say infrastructure in this day and age when it comes to information and ICT, it speaks about, you know, your ability to get Wi-Fi. But while we can put all those things into place, it doesn't take away the fact that you need an education system and a teaching cohort that actually understands this technology. So maybe it'll be an issue where, and speaking especially from a level of your primary school and your high school, I'm actually working on a paper where we're actually finding that private schools, especially in South Africa, and I think also Kenya, as my paper was touching on, have actually been long working at this. So maybe it's a chance now for, rather than us always saying, look, let's rather do something new, let's actually look at where there's best case scenarios already within Africa. And I think Dr. Celia's touched on it by saying, look, there are African solutions. It's not to say that people have not thought about how do we digitalize education. So for me going forward, the key thing on answering this question more directly would be we need to actually say what has been working in countries. And I think the private sector has some good initiatives. So rather than going outside and trying to find and create new things, we need to ask, how have they been doing it? And maybe can we co-partner these public-private partnerships for the purposes, express purposes of actually speeding up an education system, which has been a bit far behind in answering the questions we kind of need answering now.
On demographic dividend, Yaki?
Yes, Ottilia, you know, I've done a lot of work on demographics and the demographic dividend. So I'll just make the point that Africa is still about 2-3 decades away from actually achieving its demographic dividend. We have such a young population that demographics is really, at the moment, quite a drag in many sub-Saharan African countries. But that's a little bit of a segue away. I realize that. At the moment, COVID and our youthful population provides Africa with significant protection. We know that I think the median, the average age of people that succumb to COVID, I think is something like 36. And as we also know, males are much more susceptible to COVID than females. So in our analysis, we tried our best to try and look at the gender dimension and the impact that COVID has, particularly when it comes to North Africa and particularly in informal settings. So there's quite a bit in the report on gender and the gender dimension of the impact of the disease. Thanks very much.
Thank you very much, Yaki. The next batch of questions that I'm going to pose to all of you relates to issues around peace, security, and conflict. There's a question here from John Mugonya, who asks, how will COVID-19 affect politics and individual freedoms on the continent? Related to that by another person who chooses not to be named is whether you can reflect on COVID-19's impact on peace and security in Africa. And this is related to a question posed earlier by Kim Robinson, which is the impact specifically on conflict throughout Africa. Any takers? Kelly?
Sure. So broadly, in terms of the research outcomes that we saw in terms of conflict, was that it obviously makes it much more difficult for governments to plan and strategize and implement an appropriate and effective strategy to protecting people and mitigating the spread of COVID through the various regions. And in a way, it's also linked to the question of gender, because we see that there are large numbers of internally displaced people, high levels of migration and migrants out of these conflict areas. And so this really makes it very difficult for governments to manage. And we also see that in areas where there is conflict and militant groups, these groups are often able to extend their influence and sort of fill the institutional void and really secure or gain more ground in response to COVID as they seek to sort of manage the crisis themselves in the areas that are under their control.
Jonathan, over to you. As well as Yaki after Jonathan.
Thank you, Ottilia. Building on what Kelly said, we've done additional research that isn't published as a part of this report, but it looks at the effect of COVID on state fragility and state failure around the world. And what initial model results suggest is that we're likely to see a significant increase in the number of cases of internal conflict that will break out as a result of the economic reductions and government responses in light of COVID. Our estimations would suggest that in West and East Africa, you should see about one to two more cases over the next 3 years of state fragility or a significant increase in domestic conflict driven by COVID. And there are hotspots that break out as a result of this modeling in various places around the world as well. So it's a real challenge. So thank you.
Yaki?
Yes, just to add that actually, Jonathan has largely summarized that the main driver of instability or stability is state capacity. And what is happening with COVID is that African governments are going to lose significant capacity. And that translates into more instability. Countries are not only unstable because people are unhappy, but also because of the ability of governments to provide stability. And what's going to happen with COVID across every dimension of government expenditure is that all of that comes under pressure. So educational, health, security, and other budgets are all going to decline and decline quite dramatically. And in the report, we speculate on the fact that in actual fact, what is going to happen is that Africa in the next few years is ironically going to become slightly more dependent upon aid, particularly low-income African countries, despite the fact that aid revenues will also be under pressure. So I think Jonathan's put his finger on it, and that is that the impact of COVID is probably to increase instability on the continent. And we've already seen these shifts. And I think that we've already seen that while armed conflict in Africa has been declining over decades, slowly, what has been happening is that violence, riots and protests has been increasing. It's also a function of democratization in Africa. And I think what COVID will do is it will accelerate that trend. So particularly urban Africa will become in a certain way more unstable because of this.
Thank you very much. The next batch of questions relate to two things, the economy and then also on issues around ICT and innovation. So the first question from Junior Ngulube asks, based on reflections from a lot of economists around this being potentially a crash far bigger or at the same level as the crash that happened in 1929, how can, or how rather will that blowback from developed economies affect or impact the African continent? Related to that in some way is a question from Gilbert Madda, who asks specifically to Kelly, what is your take on the impact of COVID on the on diaspora remittances? So money coming from developed nations back to the African continent. And then on issues around ICT and innovation, there's a question from Hilaire Poicam, who asks, how can there be encouragement of African governments to invest more in ICT, to make Wi-Fi more efficient and available everywhere, and also to boost entrepreneurship, research, as well as innovation. And Skolile asks, just as a concern on the new issue around upcoming technologies, whether these will be able to assist the recovery of African economies, particularly the informal sector, so not just the formal sector. And there are a number of other questions. Colleagues, we have the seminar still for another 25 minutes. We will try our level best to go through all of the questions, but as you can appreciate, this won't be possible. So if we don't get to your question, please do forgive me particularly, but also forgive the panelists for not being able to go through everything. So I'll go first to Kelly, because there's a question posed directly to you around remittances. And I see Marius itching to say something on issues of the economy and ICT.
Super, thank you. Yes, so what we found is that there's an expected, I think, about 23% decline in remittances that will be coming into the continent. And that obviously has significant impacts for particularly vulnerable people in terms of their livelihoods and their ability to sort of stay above the poverty line. As we saw in Yaki's presentation at the start, extreme poverty is expected to be increasing as a result of this COVID crisis. And I think that this will really be one of the factors that exacerbates that. I'll hand over to Marius.
Thank you, Marius, over to you.
Thank you, Kelly. And perhaps Stella wants to comment on the ICT side. A couple of comments from me from the global economic, macroeconomic side. It is true that Africa will be severely affected by the global recession. We did see the IMF yesterday increase the depth of the recessionary forecast to over 4% at a global level. Of course, that's going to affect Africa. But I think there are some interesting dynamics at play where in the previous recession, in the 2008-2009, the origin of that crisis was, of course, in the financial markets. What we're seeing now with the COVID pandemic is that the origin of the recession is in the real economy that's contracted, that's being prevented from performing. And of course, with the reduction of economic activity, there's a reduction in consumption, driving down demand around the world. Now, African countries exposed to commodity export will be particularly vulnerable, energy exporters particularly vulnerable. But the flip side of that is as countries look to onshore manufacturing, for instance, and look to localize some of their supply chains, there may very well be an opportunity for African countries to take advantage of that. We know, of course, that Africa's key structural problem is unemployment, particularly youth unemployment for low-skilled, semi-skilled workers. And so during the pandemic's early stages, we saw mask making, production of sanitizer, really low-end manufacturing products that Africa could very rapidly begin to produce. Now, of course, the risk is that Chinese manufacturing or other Asian markets with low-cost manufacturing would simply overwhelm African markets in this regard. But with the right combination of protection mechanisms, tariffs, and other features from a policy point of view, Africa may very well be able to take advantage of those opportunities in the short to medium term and to improve the structure of the economy in that regard. Stella, anything from you on the ICT side?
Yes, please, Stella.
Yeah, thank you, Marius. Yeah, so I think there's real opportunity on the ICT side, given that education has now moved online. We are increasingly realizing that perhaps ICT and just internet access is a utility and should probably be a basic, everyone should have basic access to things like the internet. So going forward, given that education has moved online, a lot of students are not even able to catch up with the education. And I think this presents a great opportunity for Africa to then invest on these things and get moving in that aspect. So I think that's an opportunity for Africa to develop them. Thank you.
Right, there's a question here that's been posed by Francois Gultig, which is this not the time that we can maybe look a little bit inward and maybe stimulate these discussions around an African continental free trade area? So having looked at all these issues, what can Africa essentially do for itself? And perhaps related to that question is a question posed by Steve Siziba, who asks about how, any analysis maybe on migration and particularly labor migration patterns in the continent that have been affected by COVID-19, and how would that play out? And then a question repeated several times by Manji Dial Augustine from Nigeria, who asks from all of you, perhaps, your assessment of African solidarity in the face of the COVID-19 pandemic. On the continental free trade area, Yaki, I'm looking at you, and I'm also looking at Jonathan.
Attilia, yes, I as part of Africa First, the book that I published a few months ago, I spent a lot of time looking at leapfrogging and the potential that ICT has, as well as the implementation of the African Continental Free Trade Area. And these are two of the interventions, two of the areas that we need to speed up. I believe that the impact of COVID hopefully is to focus African minds. The crisis that we face on the continent is deep and structural. And if we do not use the potential of the African Continental Free Trade Area for a variety of reasons that relate to greater changing the productive structures of African economies and trading more with ourselves and so on and so forth, as well as the opportunity of digitization to transform the nature of African economies, we are not going to work ourselves out of this. This is all about focusing Africa on helping itself. We consistently look at others to come and save Africa. what we should really be seeing is that this opportunity hopefully will help to change the nature of how Africa engages. And there's been some remarks about, and we have spent a lot of time at looking at the extent to which the digital economy is also a way to formalize greater aspects of the African economy through a different way of which economies sometimes in the rest of the world have developed. And I think that those are some of the areas that digitization, leapfrogging, and the implementation of the African Continental Free Trade Area and the opportunities that they unlock, that we really have to seize if we are going to work ourselves out of the impact of COVID, which is deep and structural on Africa.
Thank you, Yaki. And Jonathan?
Yeah, thank you so much. I just put in the chat a publication we worked on that was published earlier this year looking at the effect of the African Continental Free Trade Agreement working with NEPAD. I echo everything that Yaki said in this space. One of the effects, as some of the commenters here mentioned, is that the effect of COVID will be very differential across different countries depending on which countries Africa are dependent upon for imports and exports. Understanding the relationship of dependencies between supply and demand on the international basis will create a framework for thinking about some of these third order effects from COVID. So we have these primary effects from the disease and these secondary effects from government responses, and then these third order effects filter out through these systems of international influence. We had authors here talk about the rise of the East and influence in Africa there. So I think pursuing the African Continental Free Trade Agreement should remain a significant strategy, but I think Africa should also have strategies, more broadly speaking, that focus on managing interdependence with the outside world and internally focusing on increasing export diversification. And that can be export diversification across really any kind of set of products. Of course, focusing on manufacturing, but other products as well. Within Africa, African exports within the continent have very low what's called economic complementarity, which means that the exports are really kind of a similar kind of type of good or service. And the more that that can be diversified, the more that the intra-African trade structure can be made more robust and kind of, I mean, you're really working to overcome some of these structural issues that are associated with colonialism and the whole history of exploitative infrastructure development and things like that. So I do think a broader policy of what I would call managed interdependence is something that should be pursued along with this African Continental Free Trade Agreement.
Thank you very much. I'm now going to go into the last batch of questions to everyone. But in asking this last batch of questions, I am going to essentially do a tour de table of all the panelists and the presenters on, once you've answered the questions, we'll do a very quick round where you give us one urgent thought from you. If there's anything that needs to happen, what should that be? Don't give me two, don't give me three, just one from each of you. But before we do that, there's a question here from Frederica Bubenza, who asked a question about mental health and whether this features at all in the report. But perhaps, and knowing the report as I do, that it's not really covered in the report, but it's an issue that I think all of you in various ways can reflect on, which is how economic hardship, particularly in countries such as our own, where there is high inequality, a high impact, not just on the economic conditions of people, but on the social and personal impact as well. If any of you can be able to share your reflections on that particular point. And this is a question, I think, related also to something that Yolan Friedman has asked, which is about how can we ensure that we respond to the issues around poverty and inequality specifically, while also dealing with the health concerns. So I'm going to ask you to respond to these questions, and then buying you some time here as you think about your main key nugget. So I'm going to turn first to you, Kelly. Sorry to pick on you, but I'll turn to you, Kelly, on any reflections you have on issues around economic hardship specifically.
Perfect, thank you. Yeah, I mean, the economic hardships, I think well, COVID has really, I think you said it the other day, exposed the blind spots in terms of development on the continent and really brought to the fore these challenges. And we see it in terms of things like people, you know, it's predominantly girls, for example, who are now being pushed into child marriage, or households are being increasingly affected by trying to survive, trying to make sure that they can sustain themselves. So yeah, I think it can be quite a bleak and depressing picture to think about those economic impacts. But if I link it, so I'll give you my summary point as well, my last thought, which is really just that I think cross-sector collaboration and partnering with organizations across government, business and civil society is really the way forward, because that will really give a line of sight into different aspects of economic livelihoods and the economic and social impacts across the board in terms of the impacts of COVID. And I really think that by partnering and bringing in these broad collaborations, it will be, governments will be able to really draw on the strengths from each sector and really be able to hopefully drive forward economic transformation in a positive and meaningful way.
Thank you. TK?
Last point, right?
No, if you can...
Oh, sorry. It's getting to supper time this side, so I'm thinking...
Yes, I know. If you can maybe just reflect a little bit on these points around, you know, the social impact, obviously medium to long term. You did touch on it in your presentation around recognizing inequality, informality, and trying to match any response to the realities on the ground. So let's not shape responses only for the middle income and up, but also for people whose livelihoods are greatly threatened by COVID-19 now and into the future.
Yeah, and it will also be a part of, because as I was thinking, it's the issue of, we always keep saying government in Africa must work, but I think maybe we need to change it to say, look, Africa will work when local government works. What COVID has actually exposed is the gap between national to local government. And I think a lot of the politics, even if you read a lot of the journals, it's always been this issue that there'll be some macro national government enforcement that will come and save us. But we've seen that if you cannot fix local government on the, especially at the ground level, things will not work. And by that, I mean, what has actually been quite interesting to see and observe is when local governments have been asked to actually take almost data to actually consolidate data for the plain purposes of pooling funds for national government, they've actually struggled. There's some reports coming out that, and I'll speak specifically here to South Africa, when it comes to the issue of where they're giving out food parcels, where certain local governments simply could not even get that simple data. And that has been speaking to the fact that we've not actually had the right people at local government. So if we're going to really see an Africa that works, when I'm speaking, as you're saying, when you're speaking about the issue of saying, when you want to really cut down inequality and ensuring that people get the best of education, which is you need to actually know how many people are living in informal areas. What is the living condition in terms of when we're rolling out infrastructure, do we actually do a proper head count? And for this to happen, it has to come through the levels of local governments. And so I think that's one of the quickest things which we really do need to focus on, and COVID has shown us that we need to do that. And also the issue that and I know it's always rough to say this because it's almost as though you're speaking from a point of privilege, is as Dr. Sirius has said, COVID has shown us that because we've been slow to address these issues of inequality, we almost have to now suffer another 10-year lag to actually address that issue. And I think great communication has to be made to the people, and government has to be shown to also be part of the sacrifice, which is to say you cannot have governments and and I'll speak specifically about politicians, looking as though they're living outside of the rest of us as a population. If you're saying we must sacrifice, we also must see government sacrifice in the same way. But people want to see those sacrifices played out at the ground, which is to say, is my school actually addressing the issue that we need to actually look at girls' education? Is my mother able to she might not have the greatest job, but is the job she's able, can we please create some form of job so that there's some income coming into the houses? So, and I think for this all to happen, for me, the main argument has to be, we need a local government which is capacitated, which actually understands public policy, which actually understands tools such as the scenario-based thinking to inform its planning going forward.
Thank you very much. I'm now going to do a quick round through all of our speakers. And if you can, please, share with the audience, almost take us into your confidence about what it is from your point of view, one key point through the research that you've done now, but also in the work that you do in trying to get the right kinds of evidence-based responses and action on the African continent. If you can give me one thing that you hope to see happen in the coming 5 to 10 years, but that you hope will be able to propel Africa's growth. I'm going to start with you, Yaki. One thing, and please, your pet dog should not respond.
Poppy is a very nice dog. What Africa needs is much more rapid economic growth, eventually in the formal sector. And I think that the COVID provides an opportunity to speed up the transformation, the digitization, the growth path of Africa. And for that, and it was mentioned quite a lot, one of the key requirements is just to move Africa into this modern digital economy. It has all kinds of benefits, and we need to take responsibility in taking that forward. So that is our future pathway. I'll stop there.
Thank you, Yaki. Jonathan.
Governance, improve the quality and inclusion of governance.
That's wonderful. I think it's something that the Hans Seidel Foundation, that did pose a question earlier, also wanted to see reflected quite clearly. Kelly.
From my perspective, I would think, also informed by the research that I do, I would like to see a much stronger focus on businesses focusing on inclusive growth, organizations that work to create shared value, and much more of a focus on these hybrid organizations that have a dual social and economic goal that can sort of advance the economies of the continent in that way.
Marius?
Thank you, Atilia, and thank you to my fellow researchers for a great session. My final point links as well to something Hans Bühler says from the Hans Seidel Foundation around Africa EU, and that is that Africa needs to take a long-term view, and our multilateral partners, whether it's the EU, whether it's the US or others, need to be our partners in taking a long-term view of Africa. If we take a lesson from the Arab Spring, from the insecurity we've seen in North Africa, coming from the Middle East, and the way that affects our partners around the world, there's really no shortcut to getting Africa to a place where it's more stable, more secure, more prosperous, and in the end, benefits all our partners in the process. And so, if Africa can have the governance, as Jonathan says, and build on that to mobilize those partnerships to address this crisis, it can put us on a long-term trajectory, and that's what we would need.
Thank you. Stella.
Thank you, Otilia. My comment is around greater community engagement. I think we often sideline communities and come up with policies and take them down that people should, then, I don't know, comply and adhere to those policies. So greater community engagement is super important because communities know what they want and they often come up with local solutions to their problems. So that's it for me.
Thank you. And TK?
I think for me, it's the issue of trying to get our informal economy, as Yaki has said, to a more formal level. We simply cannot ignore them any longer, and we've seen that ignoring them is essentially ignoring a large population in our African continent.
Thank you very much to all of you. If I take anything away from what you've said and to our audience, you've heard it from the experts. They do all the hard work. I just chair their events. That we need to be looking at issues around digitization, including communities, not only in the responses that we shape, but also particularly importantly, in actually getting them to provide their input right from the start. And that does mean working together and having the global partnerships that Marius talks about with our partners, whether it's from the European Union, the US, or from Asia, that we work with in order to be able to stimulate growth on the African continent. But also, and the point that TK makes around ensuring that no one is left behind. The realities on the African continent, there are more people working in the informal sector than in the formal sector. So perhaps it's about turning things on its head and ensuring that that sector of society is not marginalized when in fact they are the majority. I can't thank you guys enough, not least for doing the hard work in the research, but also being able to articulate it in a way that just makes sense. So Yaki, Jonathan, Stella, TK, Kelly, and Marius, thank you very much for your hard work. But also behind the scenes, people like JD and Mugibe, who've been integral in supporting the work of the group in doing that. And a special thanks to the people who were part of the reference group, USAID, the government of the Netherlands, the German Federal Ministry for Economic Cooperation, CEDA, SWP in Germany, UNDP, UNICA, OECD, the African Risk Capacity Group, CEIC in Angola, Good Governance Africa, as well as the new Partnership for Africa's Development, or the AU Development Agency, for being integral parts of the research process and informing the policy recommendations that you will find in the report that was shared with you by a link in the chat function. To all of you who've stayed with us during the seminar and who've posed your questions, there were 31 questions that were posed to our panelists. We were able to respond to 23, but I hope those of you whose questions were not responded to can at the very least forgive me for not getting to them. I'd also like to pay a special thank you to the Hans Seidel Foundation, a strong supporter of the Institute for Security Studies, as well as Humanity United, for funding this research and allowing this team to be able to do their work. And finally, to my colleagues at the Institute for Security Studies, to counterparts at the Frederick Pardee Center, as well as to colleagues at GIBS, thank you so much for your hard work and particularly for presenting this work. Colleagues, this marks the end of our seminar. You have 3 minutes to spare, but again, thank you very much. And please do evaluate this event. A link has been shared several times throughout the course of this event by our colleague Zashel, who's been keenly ensuring that we're able to host any of these events. So please do click on that link and share your feedback with us. We appreciate your honest, critical, and constructive feedback. So don't feel pressured to be kind, but please be honest. And with that, to our colleagues that are in the US, enjoy the rest of your day. Colleagues that are in Asia, I hope you rest well tonight. And for those of us in this time zone, please enjoy the rest of your evening. Thank you very much.